Welcome to Contract Administration at Stanford Medicine, a shared service of Stanford Healthcare, Lucille Salter Packard Children's Hospital at Stanford, Stanford Healthcare Valley Care, and other Stanford Medicine entities.
Contract administration aspires to be the national leader in healthcare contract administration. One way we achieve this is through a streamlined and seamless contract management process. In this video, you will learn how to easily and efficiently manage your contracts so they are renewed or updated before expiring. To help you understand how to use our contract management process, this video will cover an overview of the master contract database, accessing contracts, tracking contracts, renewing or terminating contracts, and resources available for your use on a 24-hour basis.
An efficient process for managing contracts supports contract administration's goal to be the national leader in healthcare contract administration by consistently delivering exceptional and timely contract management and legal review services. Stanford Medicine uses a master contract management database to conveniently store all contracts in one location. Contract administration uses it to store copies of contracts and other related documents, track the responsible parties for contracts, track the expiration date for contracts, track whether a contract will auto-renew, track other items of information relating to contracts, and run reports relating to contracts. To create a username and password for the contract database, complete a contract database access request form on the Contract Administration website. Contact us anytime at contractadministration@stanfordhealthcare.org for any assistance. The Contract Administration Contract Database gives you multiple easy options to quickly search for contracts within the database. These include annual contract evaluations, where you will find vendor evaluation forms used to evaluate vendors in accordance with the Centers for Medicare and Medicaid Services and the Joint Commission requirements. The Contract Administration button provides access to active contracts that aren't stored in any other organization. This database, which is the focus of this video, is where most contracts are stored. The Office of the General Counsel houses contracts involving the Stanford University School of Medicine and Physicians. Stanford Healthcare Valley Care physician contracts are the agreements we have through the Hospital Committee for the Livermore Pleasanton areas involving physicians. Terms are physician time records associated with physician administrative service contracts. And in the University Healthcare Alliance Physician Contracts Organization are UHA physician agreements. There are several options for searching for contracts. The first option is to limit the search criteria, for example by department, contract type, and/or vendor or other party. These limiting search criteria can be used individually or in conjunction. For example, you could limit the search by department or by both department and contract type. The second option is to conduct a keyword search. Enter a keyword or the contract number in the keyword field. Start the search as broadly as possible to ensure the desired contract is not excluded from your search results. For example, search Philips instead of Philips Electronics North America. When using a keyword search under the contract search options, select the applicable full text option. Selecting contract data only limits your search to just the metadata entered into the database. Selecting contract data and text enables you to search both the metadata entered into the database and the text within each contract loaded into the database. Your third option is to use the navigation window. Clicking on one of the search criteria provides a drop-down menu and other buttons to conduct a search. We recommend searching by either vendor or contract type. Once you locate a contract, click on the hyperlink contract number to access a copy of the contract or the most recent amendment. The Cover Sheet tab has additional information, such as the primary and secondary responsible parties for the contract. Contract administration also stores additional documents related to the contract under the tab labeled Contract Attachments. The training guide on the Contract Administration website provides additional guidance on how to easily access a contract in the contract database. The contract database allows for detailed reports of all the contracts you have access to. To run a report, in the navigation window, click Report Writer, then select Custom Reports from the drop-down menu. From available fields, select the fields that you would like included on your final report. To add the field to the selected fields list, either double-click it or select it and then click Add. You must add limiting criteria to your report. Otherwise, your report will include every contract in the database. First, select the criteria to limit from the drop-down list. For example, department, responsible party, or expiration date. Next, enter the applicable limiting criteria in the field. For example, you will probably want to enter your organization and your department name. We also recommend that you run a separate report by cost center numbers. Then click the Add Criteria button for each limiting criterion. To generate a report for expiring contracts, follow these simple steps. Select expiration date as the limiting criteria. Under User Instruction, enter within the next 90 days, or 60 days, 30 days, etc., and then select Add Criteria. Now it is time to name and export your report. Edit the title of the report under Report Title, so it no longer reads as My Custom Report. Select the database that the report will pull from. Select the format for the report. We recommend Export to Excel. And finally, generate the report by clicking Run Report. Now it's time to finalize your report. When asked in the pop-up screen, do you want to leave this site, select Leave. The contract database will generate the report, and you will see an Excel file icon appear at the bottom left of your browser window. A training guide on our website provides additional guidance on how to run and save reports. You'll receive an email alert advising you that your contract is set to expire or automatically renew if you are listed as either the primary or secondary responsible party. Here are the steps to follow once you receive an email alert from Meditract. First, evaluate your relationship with the vendor and determine if you would like the contract to continue or terminate. Some factors to consider are: is the vendor meeting the expectations? Are the services still required beyond the expiration of the current contract? Is the vendor still offering a competitive rate, or does some other vendor do the job better? Second, review the contract for an automatic renewal provision, such as this agreement will renew automatically for successive one-year terms, subject to the termination provision hereof. Finally, determine what action is required. Depending on whether the contract will expire or auto-renew, determine whether you need to take action or contact contract administration to make any necessary changes. If the contract auto-renews and you want it to continue, review the terms and conditions to determine if any changes should be made. For example, changing the compensation amount or the services to be performed. If changes are required, go to the Contract Administration website and click on Request a Contract to submit a contract request form that describes your changes. If changes aren't required, send an email to contractadministration@stanfordhealthcare.org and advise that the contract should renew for another year. If the contract auto-renews and you want to terminate it, send an email to contractadministration@stanfordhealthcare.org so we can prepare a letter of non-renewal. Many contracts that auto-renew require that the Stanford entity provide advance notice within a certain time period before the auto-renewal. Be sure to allow sufficient time for the letter to be prepared and sent. If the contract does not auto-renew and you want it to continue, submit a contract request form and ask that Contract Administration prepare a new agreement or an amendment to extend the term of the current contract. If the contract does not auto-renew and you want to terminate, simply send an email to contractadministration@stanfordhealthcare.org. Contract Administration will then archive the contract so that you no longer receive email alerts. Unless a contract is archived, you will receive additional emails 90, 60, 30, and 7 days before the contract is set to expire.
With an exceptional team and an innovative process, Contract Administration has truly revolutionized the way contracts are reviewed, negotiated, and managed within the healthcare industry. Contract Administration has created a variety of educational tools that provide step-by-step instructions, guidance, and answers to questions to help make your job easier. You'll find helpful training guides on numerous relevant topics on the Contract Administration website. We hope you found this video helpful. If you have any questions, please don't hesitate to contact us.